Hi, I'm Dr. Chris Ward with the Dental Implant Center of Oklahoma. I want to address some expectations for patients once they've accepted treatment. So, you've come in for your consultation. We've talked about all the different options for you specifically, and you've decided this is a particular treatment that I want for myself, and I'm ready to get started. Let's go. Expectations for you are a couple. One is we're going to make sure you're safe and healthy during the procedure. So if there's any concerns that come up in the consultation where I need to get with your physician, make sure I understand medications, interactions, anything that might be a problem in keeping you safe, we're going to address that all prior to the day of surgery and get consents before we ever get started. The other thing that happens is once you've said yes, now we've got to make teeth. We've got to decide, how am I going to have you day of surgery, where we come in, we take all these bad teeth out, deal with the infection, deal with whatever we've got to deal with. But I want you to leave with implants where teeth are attached. So I've got to start the process of making temporary teeth. So you'll come in for a procedure for records, which will take about an hour. We're going to take a lot of pictures. We're going to take scans. We're going to take digital impressions. There's things that I need so that I can plan to give you the nicest teeth that I can from a temporary standpoint. Now, these teeth will typically last you 3 to 6 months, depending on how long we're delaying going to the final restoration. We've got to give the implants time for the bone to physically grow to the implants and to what we term integrate, so that they're solid, so that they can maintain the forces or handle forces and stresses that are going to happen as you get to a more normal diet. So we're going to do the things in this records appointment so that we can get ready for the temporary phase. The temporary phase typically takes about 10 days to 2 weeks from the time we get records until you're ready for the day of surgery. That process gives us time to get all the clearances, and it also gives me time to design what we need to for your teeth. Once that's ready, we're ready for surgery. So day of surgery, you're going to come in and we're going to put you to sleep. And the goal will be to give you teeth the day that you leave or the next day, depending on your situation. It's great to get to do that, and I hope that helps you a little bit about what this next step will be.